For years, I suffered debilitating symptoms before I was finally diagnosed with Crohn's disease. At that time, I was out on an island alone, trying to figure out this incurable disease. I have what's considered metastatic Crohn's disease, which means that it affects just about every part of my body and has resulted in debilitating arthritis, neuropathy, skin issues, vision issues, as well as my inability to have children naturally. For years, my condition progressed uncontrollably and unnecessarily because of the protocols that are in place by healthcare providers to mitigate costs of healthcare.
Utilization management is a very unfamiliar term to a lot of people, but the techniques, I'm sure, are pretty familiar to a lot of patients. So those techniques can be step therapy, which requires patients to fail first on an insurance preferred drug before taking something that may be originally prescribed by that patient's provider. My role at the Cancer Support Community is to lead the Cancer Policy Institute. As we know, a collective voice creates change, and CPI has become a convener and a leader in really promoting patient-centered public policies. The Forum on Utilization Management was created back in 2019, and our main mission was to convene other patient advocacy organizations to talk about how our utilization management techniques affecting our patient population and what can we be doing to create a more patient-centered approach.
Utilization management can be devastating for people living with chronic illnesses. This forum has a goal of uniting communities across the board of disease states and becoming a unified collaboration for change. I was a part of the step therapy reform that passed here in Georgia in 2019. And that was in collaboration with organizations that came together and collaborated on a mission to enact change for the patient.
I think having an advocate like Stephanie be at the center of the discussion is crucial. She is one of the ones that we want to take to Capitol Hill or want to take to the state level to really show policymakers that the decisions being made are directly influencing people, and we need effective policies to work in order for them to take back their lives from the diseases that they're facing.
I'm grateful that God has given me this opportunity to share. I'm grateful that my life now has meaning and purpose, even with this disease, in spite of this disease, that I am making change, and that change feels good.